All right, so let's start the second part of the pituitary gland disorders. We talked about a hyper-functioning pituitary gland where you typically get the gigantism and the acromegaly where you have too much growth hormone. We're going to talk about dwarfism. Dwarfism is the total opposite. It's where you have a hypo-functioning pituitary gland, which typically means that you're going to have someone in short stature. Their long bones are just not going to grow very long. They're not going to grow to be very tall. And of course, with pituitary gland disorders with dwarfism, they never have any problems with neurological issues. They have normal intelligence, normal IQs. They typically function very normally. They're just short little people. Typically, how we treat them is in early adolescent, usually before puberty. We will typically give them growth hormone. Because typically, because they do not grow after adolescence, that's typically when we want to start giving them that growth hormone. So it can possibly give them a few more inches to help them grow to be a little bit taller statue. All right, the next one we're going to talk about is parathyroid disorders. Parathyroid disorders have a lot to do with calcium. The first one we're going to concentrate on is hypoparathyroidism, also known as tetany. This is actually a very dangerous disorder. What it typically means is that you have hypocalcemia. And if you break this word down, hypo means below, calcia, which is calcium, and emia is blood. So you have low calcium in the blood. If you don't have enough calcium in the blood, typically what happens is that the nerves and muscles will typically cause a twitching or kind of a spasming, kind of like a Parkinson's type thing, but it typically is a little bit more abrasive, where you'll kind of see it more of that spasming and twitching. Again, the complication with tetany is that it is very, very dangerous. And of course, it can affect one of the most important muscles we have for respiration, which is our diaphragm. Remember, our diaphragm is that parachute muscle located right up underneath your lungs that will contract and go down when the lungs need to expand and relax and go up when the lungs expel CO2 or exhale. So again, very, very dangerous, tetany. Now, hyperparathyroidism is actually the opposite. This is low and this is high. So hyperfunctioning parathyroid is typically where you're going to develop hypercalcemia. And what that means, hyper means excessive, calcium, emia is blood, so high levels of calcium in the blood. What happens when you get too much calcium in the blood, number one is that it takes it out of the bone. And remember, we need calcium in the bone in order to have strong and healthy bones. So, of course, these patients with hyperparathyroidism are going to be prone to breaking bones very easily, that type of thing, because of that hypercalcemia in the blood. The other problem, too, is that, remember, the kidneys they filter the blood. And so calcium is one of the electrolytes that it helps to balance in our body, so it does filter out the calcium. But if it has to filter out calcium constantly over and over because there's too much calcium in the blood, what can develop, of course, we learned about in urinary system, is you can develop kidney stones. So complications that can lead from hyperparathyroidism is those fragile, weak bones, because the bone that should be in the calcium that should be in the bone is going to end up in the blood instead. And then, of course, the calcium buildup from the kidney, filtering calcium, and that excessive amount of calcium in the kidney is going to eventually could lead to kidney problems such as kidney stones. The next disorder we're going to talk about is your thyroid. Remember, your thyroid gland is a butterfly-shaped gland that's located right here underneath the larynx on the trachea. This is what normal size should look like. It shows you kind of in a shadow, but with hyperthyroidism, that's where you have an excessively large thyroid gland. Okay, so with hyperthyroidism, usually it's caused by an autoimmune disorder that we really don't know what causes it. We just know that unfortunately, your normal cells start to attack, your immune cells start to attack your normal cells. It's also called Graves' disease. The symptoms here are going to be bulging of the eyes. Typically, you'll see very large eyes, very wide. They'll have very large pupils. And they'll also, too, develop goiters around their necks, which are these large tissue-like protrusions, kind of tumor-like protrusions that will be on their neck. Typically, how we treat it is that we will do specific types of drugs. And if the drugs aren't working in a short amount of time, sometimes they'll even go to partially removing the thyroid gland or just removing it totally. So it kind of just depends on the patient and the symptoms and the types of drugs that they've had them on and how much success they've had with those drugs. Again, hyperthyroidism. All right, let's go to the opposite end of the spectrum. The next one is hypothyroidism. Hypothyroidism is actually the opposite. It's typically where you're going to have low thyroxine or low salt levels in the blood, so low iodine. Typically, these patients will do better with kind of a little bit of salt in their diet. Symptoms will usually include they'll have very itchy skin, very brittle hair, they'll complain of constipation, nighttime muscle cramps. Typically, we treat with medications. Here's an example of a medication that Ms. Clayton has given quite frequently in the hospital. It's called Synthroid. You typically give it really early in the morning, like I'm talking like 6 o'clock in the morning before you even think about eating breakfast, is when the mechanism of action actually works the best. And of course, this is a very common medication that eventually you'll have to be put on if your thyroid is not producing enough of that thyroxine in your body to help with the calcitonin. All right, so that pretty much sums everything up. I hope these videos helped you out, and I hope I don't sound too dorky. And please read the chapter. The chapter is also listed on Google Classroom as well to help you with this unit to ensure that you gain all the knowledge you need to pass the test. You will get a study guide as well, but please make sure you have your notes and you've taken your notes on the back and front of the piece of paper that was given to you. Also, too, we'll do some case studies on these disorders too to help you with that as well. So we'll follow those case studies. And then last but not least, please make sure you complete the worksheet. That will help you kind of solidify your knowledge and help practice a little bit of what you've learned. If I went too fast in these slides, I'm really sorry, but the slides are on Google Classroom. You can go back and just download the regular PowerPoint and look at the PowerPoint and fill in your notes from there. All right, thanks so much.